Okay, cool. We're recording now. And are you okay with us potentially using this, making this video public, Katie?
Yeah, that's fine.
Okay, great, cool. Okay, so let me share with you, what I'm looking at, what I'm seeing, hear
Mhm.
what your thoughts are. Basically, I'll share with you, what I'm thinking. And this is pretty much what we put in the application was, I really want to have some things from the Lancet, that was co-authored by the people that are leaving the FDA. I
Yeah.
want to bring up the fact that, that quote that I used in the application, that Dr. Fauci is essentially advocating for the WHO's position,
Mhm.
and that, that they're not setting up, the feedback opportunity in any way to really, have any meaningful input, and that it's really shameful, frankly. I'm probably going to use that word.
Okay.
Um, yeah. So, but that's those three things. I'm pretty sure whatever I want to say about the three of them is probably going to take the whole 2 minutes for me.
Okay.
So I don't know if you've tried like timing anything out. It goes pretty quickly. And
Yeah.
and what I said to Sabah last night when we were talking about it, and then I put in the note here, I don't know if you saw this note yet, is
Mhm.
that this document can be a lot longer than we need, and then we can cut it down. We can use a much more detailed version on the website and even record a presentation that is as long as we want. And I'm going to do my best to do that before tomorrow morning. So,
Okay.
I expect to kind of come up with a document here with like all of our choices. That's, more like a 10-minute presentation or something like that, or maybe even 20. But then, we'll cut it down. And I'm showing you what my kind of top three things are. The
Mhm.
one kind of wish I have, I guess, I don't know if you saw this and, what your thoughts are, but I just seeing your note here.
Yeah.
I don't know if I need to say anything because we do cover a majority of these things later. So in terms of what the WHO is saying,
Yeah, it just kind of for me felt like beating a dead horse. Like, you know, can only say things so many times. But
well, what parts do you want to say? Because these are the parts that I personally would want to have said. And I thought you were going to cover in what you're doing, but you tell me if there's other. Did you not want to have quotes, or what are your thoughts as to what you want to say or not say?
well, I have a quote in there, so
So I'm
I'm fine
finding
with
it
having
now.
quotes.
So this
Yeah.
quote: economically, epidemiologically, and morally, it is in all countries' best interest to use the latest available data to make life-saving vaccines available to all.
Mhm. I kind of feel like that covers the second quote that you put up there because it's kind of saying the same thing.
I will not stay silent when the companies, countries that control the global supply. Yeah. Well, there's certainly definitely a different tone to it, right?
Yeah, definitely.
So you prefer clearly to use the tone that you're choosing rather than the tone that I'm suggesting here, right?
Yeah, I guess my personal preference when I speak is to be, I guess I would call it, uh, I want to say democratic, but like I'm a very non-confrontational person, so I like to have a little tone down tone. I don't know if that makes sense.
Yeah, it's totally fine. What I'm thinking, because again, I'm trying to, in my mind, I'm thinking about what I'd like to have in front of the FDA. Um, I would prefer to have them receiving that information, but I understand your consideration, and I understand that we're talking about, part of what you're going to be sharing, because I have these other parts, as I've said, that I'm going to share. I don't. I don't think I can really, well, I'm not going to try to fit that in since you're covering it anyway. So we'll have you, share the parts that you want to share. And then what I'll do is I'll take those parts and, comment on them on the website. So that'll be part of like the extended version for me.
Okay.
So let me move all of these then.
I think I lost him. Oh, and he's gone too. Uh-oh.